Good morning again, and my name is Victoria Kitcheyan, a member of the Winnebago Tribal Council and chair of the National Indian Health Board. Thank you for having me here today. As you may recall from my past testimony, the Winnebago Hospital still holds the distinction of being the only federal hospital to ever lose its CMS certification. This occurred as a result of years of mismanagement and serious patient care deficiency, including lack of staff training, lack of necessary equipment, and overall hospital operations. I know these issues have been reported to you as far back as 2010 and were again brought to the forefront in 2015. These ongoing issues have resulted in painful loss of life and much unnecessary suffering by our people in Nebraska. When this ordeal began for the Winnebago tribe in 2015, we were adamant that the Indian Health Service created this situation, that they created the problem, and that they needed to fix it. Well, as days turned into months, months turned into years, the Winnebago tribe took a stance that we could wait no longer and that we needed to solve our own problems. We initiated an intensive planning process and entered into a self-governance compact agreement with the Indian Health Service. And as July 1, the Winnebago tribe assumed full management of that IHS facility. And now it's known as the 12 Clans Unity Hospital. We're very proud of that. Since July 2018, the tribe has worked diligently to assess, stabilize, and really improve the hospital operations. Priority has included establishment of the organizational structure, board training, recruitment, and overall improvement, and of course, working towards CMS certification. The issues at the hospital did not happen overnight, so we understand that it's going to take considerable time and effort to change the organizational culture and all the necessary improvements that we need to achieve CMS certification and to become the top quality healthcare provider that we know that we can be for our tribal members. It has been a period of significant change, not only for the organization, but for the community, and it definitely has not been without challenge. But the Winnebago tribe and our team at 12 Clans Unity Hospital are confident that we can be successful, and we are already seeing those remarkable improvements at the facility. During this time of transition, your support that has been critical, the added oversight from this committee, our congressional delegation, our congressional staff, and all that would not have been possible. The tribal assumption really counted on that support to continue sustaining operations, and we appreciate that, and we look for your continued support as we make progress. Today, for example, our ongoing needs include continued recruitment. The facility has lost CMS certification. The facility has documented inadequacies. It's just not has the best reputation right now. And we hope to build up that solid reputation and make it a place that people are proud to work, where people are proud to come and receive their care. And we're confident that the tribe will be positioned to turn that place around with the necessary resources. We know that permanent full-time employees that are vested in the community as well as our facility are what we need, but that's going to take time. We heard about the 25% vacancy rate earlier, and that's something that's just our circumstance. We'll continue to work on these ongoing recruitment efforts, but in the meantime, it's a tremendous amount of money going to locum tenens contracts, nurses, providers, and addition radiology laboratory. So there's considerably more costs paying contractors than permanent staff, but we're working on it. We've also identified a need for ongoing training and technical consultation with regard to meeting hospital rules and regulations for all departments. Although the facility has been in existence for some time, it's essentially a new hospital. And the tribe has assumed management, but it includes revisions to the policies and procedures, operational plans, processes to really transition to a non-federally operated facility. In addition, meeting all the CMS requirements of participation. So, and on calling on the best practices in the healthcare industry, we want it to be the best facility for the patients, not just another poorly ran federal hospital. Another challenge was presented during the recent shutdown. We would have had great difficulty continuing our services had we not received a special appropriation from the Special Accreditation Emergencies funded in 2018. And it's that lack of third-party revenue from the LEAS CMS certification that left us without resource. And without this committee's help, we would not have had that gap funding. And so we're also really thankful in calling on that same level of funding in 2018 as we continue to make the necessary improvements. and the replacement of those funds and the CMS certification were most apparent during this shutdown. We hope to provide financial stability for the organization, and while we work to restore the certification. The Winnebago tribe also supports what we've heard today so much about, the advance appropriations of IHS, and I'll also add BIA, because we know that many of the services that those agencies provide for our tribal communities are intertwined, and they're not in the silos that sometimes we see within the agencies, but they're integrated services within our communities that collectively make up the livelihoods of our tribal members. So we want to just also give support for that initiative, and really impress that funding directly ties to the patient care and the community wellness of our tribal nations. So thank you today for this, and thank you for allowing me to speak with you once again on behalf of the tribes. And the Winnebago tribe surely appreciates the continued support and the support that we can to restore this certification and be the success story of the trauma that's happened in the Great Plains, and as well as amongst the Winnebagos. Thank you.